Welcome back to Morning Break, and today's Monday Motivations brought to you by Gates Brain Health, where we have Dr. Randall Gates in the flesh here with us today. He is a board-certified chiropractic physician and a chiropractic neurologist, and today we're talking about something I'm very passionate about, and that is autism. So for people who still aren't familiar with what autism is, even though it's becoming increasingly more common, let's break down what exactly autism is.
So autism, in essence, involves difficulties with social relationships, communication, eye contact. Frequently there can be components of stereotypical movements as well. There can be regressions in language. There's a whole new criteria and different severities of it. And so I won't get into the nuances of that, but it can be as severe as somebody not being able to talk, and it can also be on the level of someone being able to speak, but also having other components of difficulties with socialization and repetitive thought patterns, repetitive behavioral patterns as well.
Alrighty, and if this is sounding familiar because you guys watched the last time that Dr. Gates was here on the show, he brought with him a friend, Laura Hirsch, who was talking about the book that she had just written with her son who has autism and is nonverbal. They wrote a book together kind of trying to tell people, you know, about the stigma of autism and the beauty of autism, if I can say that, because I think some of the people who get this diagnosis, they're seen as having all these limitations, but if you really peel back the layers, they are some of the most incredible people you will ever meet, her son being one of them. So I encourage you to go to our website and watch last month's interview with Dr. Gates and Laura Hirsch. But we want to talk more about the brain and what is actually going on in the brain with autism, and why some kids are nonverbal when they get this diagnosis and why some aren't.
Okay, and so in the brain, as the brain develops, think of a tree growing, and we have a lot of branches, and those branches grow out. We actually want to prune the branches as the tree is growing so the tree can be as healthy as possible. Lots of times in autism, the branches are not pruned, and so there's a lot of hyperconnectivity between the neurons in the brain, and that can lead to hyperactivity in certain areas, and there can actually be lack of development in other areas. Why it is in certain areas hyperconnected and other areas hypoconnected, that I still have not seen in the literature, but that is the basic fundamental component neuroanatomically of autism. As to why it's happening, it seems to correlate with a lot of inflammation in their bodies. And parents have talked about this for a long time, that there seems to be an inflammatory trigger for a lot of kids. They may have a tendency for other types of allergies and things of that nature. So that's a big area of focus right now in the literature, looking into that source of inflammation in their body.
And does that come from like what their diet and nutrition intake is?
So a lot of parents are really on that topic, and a lot of parents of children with autism do change their children's diets. There's a lot of discussion about gluten and dairy-free diets, watching out for food colorings, things of that nature. It is interesting for those of you who are watching out there that if you don't have familiarity in that, that's a big area that I focus on with patients who have autism, working with their gut health, trying to calm down those inflammatory responses. But it seems to go deeper. So one of the new findings is that children with autism have parents who are very chemically sensitive. That's a new finding coming out. Is it causation? No, but one theory is that when you're chemically sensitive, the certain type of immune cell called the mast cell is overreactive. So we overreact excessively to our environment. We live in an environment with a lot of pollutants, chemicals, things of that nature, and it's thought that that may be a epigenetic factor. We all have genetics, but how environment changes our genetics, and maybe that's something that either is being passed on or being hyperexpressed in children with autism.
So is that something that parents can test for in their kids?
So yeah, you can actually test for activation of mast cells.
Okay.
Yeah.
Interesting.
Which is really interesting.
So are you testing yourself or are you testing children?
You could do both, but I mean, I typically am testing children.
Okay.
But it's an interesting study because there's this big question, why is autism so much more common now than it used to be? Some people say it's over-recognition. But the other argument is that something has changed in our environment that may be causing it to become more common.
Interesting.
It used to be 1
yeah.
in 20,000. I think now it's 1 in 32 individuals.
Interesting.
Yeah.
So do people typically already have an autism diagnosis when they come and see you?
Typically,
okay.
yeah. Typically,
Yeah.
most patients have an autism diagnosis by the time they find me.
Okay.
Yeah.
And then how can you help them? What are some of the things that you really like to focus on at your practice?
In my practice, I really like to focus on the holistic aspect of not only gut health, but brain health. We do brain exercises with our patients as well. And some are able to do different levels of exercises. And we're trying to activate the areas of the brain that may not be working as well as others.
Okay.
Other parts, yeah.
That's amazing.
Yeah.
Well, Dr. Gates, thank you so much for sharing your insight into this, and I'll make sure that everyone has your information on our website, colotv.com, so that you can also understand autism better and reach out to Dr. Gates if you have any more questions. Thank you so much for being here.
Thank you, Katie.
All right, we'll be right back after this quick break.